step of the way, and that's my complaint.
Okay, other comments? Mr. Bucieri?
Any athletes? First and foremost, there is competition set up in there. It was a Republican idea. We incorporated it, but only in Washington can you propose an idea, introduce legislation, and then campaign against it. Republicans voted in lockstep against state children's health insurance programs. They also voted against many of their own ideas that were included in this bill. So we've got to start somewhere. We've got to make sure that this job is not left undone. One of the biggest votes we have yet to take. We did it in the House. We need to do it in the United States Senate. There's only two industries in the United States of America that aren't governed by antitrust laws. One of them is Major League Baseball. Right? They're paid millions, aren't they? And then we have the insurance industry. And we voted to make sure that they are governed by antitrust laws so they can't form monopolies and charge whatever they want in the state of Ohio. The second thing we've done to help control costs with competition, with broadening, to make sure that folks buy private insurance. We're not telling you to buy a government plan, we're saying let's buy a private insurance on the private market. That's what's going to be in these state exchanges.
Other comments? Mr. Renacci?
Yeah, Mr. Ross made the comment that the Republican candidate or Democratic candidate is going to go down and just do what the Republican or Democrat Party wants. I can tell you that's not the case. My opponent now, you know what his history is over the last 2 years, and you know what his votes were. One thing our founding fathers did was they set up a system so that House seats have the opportunity to change every 2 years. And what I believe in is if you go down there and you violate the trust of the people in the 16th district, then you should be removed after 2 years. That's the difference. So if I am elected as a Republican and I violate that trust and I vote with the Republican Party versus the 16th district, I should be removed too. So that's really the difference. I'm going down there to represent the 16th district.
Other comments? Mr. Ross?
I'm glad he had that to say. Part of what I'd like to do with my comprehensive local plan is pull leadership away from Congress and the parties to the local officials. If we had a comprehensive plan set in place, they would answer directly to that committee and would be told by the committee, this is what we need for the development in this area. We need you to go get this resource, bring it back to us. We can check it. We can make sure that you actually did it, you actually performed the way we want you to. We design what they do. They don't get to Washington and get handed a playbook. I can tell you that everyone out there is going to say, oh, I'll be an independent, trust me. And what are you going to get? What can you do? You're going to have to vote for another one the next 2 years. And if we keep playing the same game, we're going to get the same outcome. Something's got to change along the way. And I think what we have to do is take the supervision and leadership back to the local level and make them work for us here, not there in Washington.
Thank you. Mr. Blevins, do you want to comment or no? Okay. Let's move on to another question then. On health insurance. Why must a person be working 30 hours a week before getting insurance when you can get just as sick working 20 hours a week? So the question is, why must a person be working 30 hours a week before getting insurance when you can get just as sick working 20 hours a week? We'll start with Mr. Renacci.
You know, I believe in 30-hour, again, I've been a businessman for over 27 years, and the standard of 30 hours, working 30 hours a week, is really a standard that can be written into a health insurance plan. It could be less, it could be more. I mean, I had a business at one point in time where I had over 3,000 employees, and I can tell you we had the standard less. So the standard really is based on the plan, the policies within the plan, and how that company wants to move forward and run their plan with their individuals. But I can tell you that in the self-insured plan we had, which had over 3,000 employees, our plan wasn't 30 hours, it was actually less.
Thank you, Mr. Ross.
I have no part in designing that rule, and one of my complaints with the health reform bill is the fact that it did not take the burden of health insurance coverage off the backs of employers to begin with. I feel like that's one of the biggest problems with the fact that we have trouble competing with companies from other countries is the fact they don't have to pay for their employees' coverage. They have affordable insurance, and they also have a base of a government-sponsored insurance, which they also threw out of the health insurance bill. If they had a chance to compete, get rid of the burden of covering their employees with health insurance. It would be more affordable, the companies would be more competitive, and they can afford to hire more people. So one of the biggest things we have to think about at some point, if that's not going to become where the employers just go under and move somewhere where they don't have to pay it, that's going to be something we have to deal with here, is get that off their backs.
Thank you, Mr. Blevins.
When you purchase insurance through your employer and their insurance company set the parameters and agree to a contract that stipulates some things. I think what we can do is, again, by increasing competition, we can reduce the price for the individual to buy private insurance and make it more affordable so that it's not predicated on how many hours you work or even if you do work. As long as you can afford the insurance, it doesn't matter if you work 20 hours, 30 hours, as long as you're making payments and the premiums, you're covered.
Thank you, Mr. Bucieri.
Thank you. It's good to hear all these suggestions, because guess what? We're all in the bill. In fact, you can buy across state lines now, and we have personal responsibility built into this bill. In fact, that wasn't a Democrat idea. It was actually a Republican idea back in 1993, that if you are able to purchase health care insurance, and you can afford it, you should do it, and you should be able to take it from job to job to job, and not have any lapse in coverage. So you're exactly right. People who work less than 30 hours can get just as sick as folks who work more than 30 hours. Let me tell you about a young man who's affected by this. Jack Hilliard in our congressional district owned a motorcycle dealership. He lost his dealership, but he was providing insurance for his employees and for his family. Well, he had to go out and buy it in the private market. Well, he had diabetes. He couldn't afford to purchase it because he had a pre-existing condition. So he didn't take his medicine, ended up getting a heart attack because of this. Now he had two pre-existing conditions. This 58-year-old man was sitting in my office in Washington, D.C., fighting back tears, saying, "Congressman, I pray to God I can live for 2 more years so I can get on Medicare." In a country as wealthy as ours, I remember in 2004, we flew to Iraq, carrying $1 billion of checks, our Health and Human Services Director, to make sure every man, woman, and child in Iraq had universal health care coverage. It's good enough
Thank
for
you.
Americans. It should be good enough for Americans.
Okay, any further comments from anybody on that question? No. All right. Any questions from the audience? Please go to the microphone in the middle if you'd like to be recognized. And state your name.
My name is Dan Flory. The United States Postal Service is running a $5 billion budget deficit. Social Security is now paying out more in benefits to retirees as it's taking in from workers. Medicare, Medicaid are all bankrupt. The federal government is hundreds of billions, trillions of dollars bankrupt.
Get to your question, please.
Yeah, why should I have any confidence that the federal government can run health care when every other program it has is bankrupt? Thank you.
Okay, Mr. Ross?
I don't think they're having any trouble running Medicare or the Veterans Administration. I think that they could do one thing that I'd like to see that would save them a lot of money. About somewhere around 30 to 40% of people in hospitals are there because of what happened to them in hospitals. In other words, they generate about half of their own business, and they get paid for it by Medicare. Now, if they didn't get paid for it, that would save money and probably a lot of lives at the same time. So that's one reform of Medicare I'd like to see. But I think the federal government in general can do a very good job if we got some of the party politics out of the picture, because I haven't heard anybody say, "I'm throwing my Medicare card away," nor have I seen anybody say, "I've had it with the Veterans Administration."
Thank you, Mr. Blevins.
I just simply say that I would agree with the gentleman. I don't have confidence that the government can run private enterprise either. They can't even run themselves or govern themselves as prescribed in the Constitution.
Thank you, Mr. Bucieri.
We have a $3 trillion surplus in Social Security. It's projected to grow to nearly $5 trillion by 2025. We're in a downturn because of coming out of this recession, where more folks are now using it. Social Security is solvent for decades to come. First of all, secondly, we need to set the out-of-bounds markers. Government has a responsibility and role to act as a referee. We set the goalposts, set the out-of-bounds markers, let the free market operate in between, but be a good referee. When someone goes out of bounds, throw the flag. And we can have a debate whether those markers are here or much further. But I think we should be throwing the flag when insurance companies are dumping people from their insurance, even though they paid their premiums on time and they committed the sin of getting sick. I think insurance companies need to be held account because they are overcharging small businesses, they're overcharging working families, and making our nation uncompetitive. We're competing against nations that either completely subsidize their health care through their government, or they don't care whether their workforce has a pension or whether they have some sort of standard of living. The middle class in our country is what has made our country strong.
Thank you, Mr. Renacci.
I too am going to agree with the gentleman. The government cannot run these programs. Amtrak loses approximately $30 per passenger, I read. You know, our postal service is losing money. In the Social Security system, we have passed the tipping point. We have more going out that's coming in today. And why? It's because of employment. Our employment numbers are down. We can fix and do a lot if we can get government to back off. If we can get employment back, we can get small business employing people. If we can get the economy growing again, we can do a lot to fix things, but we got to get the government out of the way. And I agree 100% with you. The government cannot operate these businesses. They need to get their hands out of them. And we need to be able to, and by the way, my opponent price that was privatize Social Security. That's the furthest from the truth. The absolute furthest from the truth. He'll take the soundbite and say those things. But I believe that's the one thing the government needs to continue to do. It needs to continue to make sure it guarantees the contract is made under Social Security.
Okay, further comments? Mr. Boccieri?
Thank you. When you hear those code words, get government out of the way, what does that mean? It means take the referee off the field. We tried that 10 years ago when we reformed, when we allowed Wall Street to do whatever they want. They made bad bets that brought our economy to its knees. We tried that. The oil industry right now, they didn't have a backup pump to the backup pump in the Gulf of Mexico, and what happened? The referee was off the field, and now we have disaster in the Gulf of Mexico. You want to take referees off the field so folks can go back to getting dumped on their insurance even though they pay their premiums? I mean, this is the clear contrast between our two candidacies with this. Now, with respect to Social Security, let's just be clear. It's not me who's saying that Mr. Renacci wants to privatize it. The Cleveland Plain Dealer came out today and said this was one of the biggest flops in Ohio politics today. He has said on his website he doesn't want to privatize Social Security, but signed 2 agreements with Dick Armey's group that's running attack ads against me right now, and also on the Project Votes Fund. So check the Cleveland Plain Dealer out today. They said Jim Renacci has come down on both sides of privatizing Social Security since today's Plain Dealer.
Other comments?
Yeah, I would like to respond. Clearly, read the Plain Dealer, because you'll see that it says Jim Renacci clearly has said he does not want to privatize Social Security. Now, on the government side, Mr. Boccieri always talks about the football field and the referees. The problem is, his idea of that is, let's set the boundaries. They did it on a healthcare bill, a 2,000-page healthcare bill, that I guarantee you Mr. Boccieri does not know what's in every page of that healthcare bill, because most don't. But here's the issue. What he wants to do, he doesn't want to only throw the flag. They want to run in. Now look, boy, bad insurance companies are raising premiums. They set the field. They set the boundaries. Now what they want to do, bad insurance companies, let's go in there again. Let's take out their quarterback. Let's remove their defense. That's the problem. The government continues to come in and in and in. I don't mind setting boundaries. I do believe there need to be boundaries. The problem with Mr. Boccieri's ideas are, we need to get in there after we set the boundaries and change the team.
Other comments? Okay, let's move on to the next question. We have someone